On today's podcast,
other doctors or even a medical student say, "Hey, Dr. Marchese, how do you treat thyroid disease, hypothyroidism?" I know that they're trying to ask me what pharmaceutical hormone I prescribe. And I say, "Well, I find the root cause of their thyroid disease.
Mm.
Do they have pesticide exposure? Do they have, lead and cadmium and mercury floating around affecting their thyroid, whether it's autoimmune thyroid disease or non-autoimmune thyroid disease? Are they nutrient and amino acid and iodine deficient, linked to toxicant exposure triggering their thyroid disease?" So I still go back to the root cause. I mean, I have so many cases of thyroid disease being either improved or coming off medication after going through an environmental treatment protocol.
if you're a healthcare provider tired of just treating symptoms and ready to dig deeper into the root causes of health issues, the Vibrant Wellness Podcast is for you. With insider tips, expert interviews, and the latest in biotech research, this podcast will take your patient care to the next level. Welcome, everybody, to the Vibrant Wellness Podcast. I'm Jen Rivas, here with my friend and colleague, Dr. Emmy Brown. Dr. Emmy, how is your Thursday going?
It's going well. Happy to be here. So excited for this today.
I am truly excited for today's conversation. We have a true powerhouse in the world of integrative medicine and healthcare, the incredible Dr. Marianne Marchese. With over 2 decades of experience, Dr. Marchese is a renowned naturopathic physician, an advocate for women's and men's health, and a champion of environmental medicine. Her journey from occupational therapist to naturopathic doctor is nothing short of inspiring, and she's been recognized as a top naturopathic physician by Phoenix Magazine multiple times. But that's not all. Dr. Marchese is not just a practitioner, she's an educator, author, and sought-after speaker, sharing her expertise in gynecology and environmental medicine with students and physicians alike. Her best-selling book, which we will talk about, hopefully, 8 Weeks to Women's Wellness, and her extensive contributions to publications and media interviews showcases her commitments to spreading the wisdom of integrative healthcare. So buckle up as we welcome Dr. Marchese to the podcast.
Thank you for having me.
Of course, we're so happy to have you, Dr. Marchese. Before we jump into the nitty gritty, I'd love to know, everybody has a different story in terms of how we get to naturopathic medicine. What was yours?
Oh, yeah, I know, right? It's we all get here on different paths, but when we get here, we never leave because it's the best medicine around, naturopathic medical school and naturopathic medicine. But my journey, it started more in the conventional healthcare field. When I was a senior in high school, I decided I wanted to become an occupational therapist. And the undergrad that I went to in Nebraska, Omaha, Nebraska, had an occupational therapy program. And so I entered that right away and graduated and moved to Chicago. And I was working with inpatient patients, rehabbing in an inpatient setting, mostly spinal cord injury, head injury, neurological, orthopedic. It was the Rehab Institute of Chicago, which really is one of the renowned inpatient rehab facilities. But I kept noticing a trend. When I was working with patients who were at our facility getting OT, PT, and speech therapy after suffering a stroke, in their medical record and in their chart, the majority of them had diabetes. And I remember one day asking the on-call physician or the attending physician, how come it seems like people who've had a stroke have diabetes? And they said, well, it's a huge risk factor. And I thought to myself, well, shouldn't we be managing diabetes better to prevent a stroke? Because rehabbing somebody back from a stroke, it's rewarding when they get better, but it's heartbreaking that they've had a stroke. And so I actually set out on the path at that moment in time to go to regular MD medical school. And I had like 1 or 2 prerequisites I still had to take, and I took those. And I was in the physician lounge, the nurse's station, studying for the MCATs. And one of the physicians said, "Oh, what are you doing?" And I said, "Oh, I'm going to, actually go back to medical school." And they said, "Why?" And there was like
Mm.
three of the physicians there. And I said, "Well, because, remember, and one of them, I said, I asked you about the diabetes about a year ago connection. I said, and I really want to work on prevention and treating the root cause." And they looked at me and said, "Oh, no, you don't want to go to MD school then because you'll just end up prescribing medications."
Mm.
And it was this eye opening that they were like telling me if I really wanted to find the root cause and work on prevention, to find a different path. And so I was sitting in a coffee shop in Chicago off Clark Street, reading, this is like in the mid 90s, reading one of those kind of alternative medicine magazines. And there was a story about naturopathic medicine and naturopathic physicians. And at that time, the internet was, not really, no, these schools didn't have websites. And so I went to the library, and there used to be these things called books with resources in them. And I looked up, and there was three naturopathic medical schools in the US. And I wrote them and got information and read more about it, and I said, "This is it. This is what I want to do. I'm going to be a physician that really works on that root cause, really works on preventative medicine, that also can kind of blend and integrate different treatment modalities using pharmaceuticals when needed and non-pharmaceuticals at the same time." And
Mhm.
it's been great. I'm really happy I chose that path.
That's amazing, and I love how those 3 doctors just happened to be in your path at the in the right place at the right time, and they really shaped your future. That's incredible. Well, I'm curious, what motivated you after this journey, Dr. Marchese, to specialize in women's health and environmental medicine specifically? Because I know that's a big area that you focus on.
So again, it was sort of just, I think the universe just guides us if we pay attention. That's how I ended up in naturopathic school. And then my third year of school, when we're what's called a secondary on the clinic shifts, and the fourth year student is kind of doing the main intake. Um, I I really identified during that time that I was interested in women's health, gynecology, and environmental medicine. I had some key physicians. Dr. Tori Hudson taught one of the courses. Dr. Dan Carter taught the environmental medicine course and ran the clinic shift. And then Dr. Kim Winstar, also really key in my development for women's health and gynecology. And so when it was my last year and I was a primary in the clinic, um, I spent a year on the environmental medicine shift and on the women's health gynecology shift. So I identified early on that that is what I wanted to do. And when it was time to apply for residencies, I applied for three, and I ended up doing Dr. Tori Hudson's residency, which is a women's health gynecology integrative medicine based residency. And in that first year, it was a 2-year residency, she said, "What are your other interests?" Because some of her residents kind of went on to focus on pediatrics or other things. And I said environmental medicine. And she said, "Well, Walter Crinian has this 6-month physician training." And I said, "Yes, I looked into it, but it's really expensive, and I'm like a resident." And I don't know what strings she pulled, but she somehow traded, like, I think weekends at her cabin at the coast and maybe his fellow coming and shadowing her, and I got to go to the 6-month physician training, and she worked it out for me, and that then solidified, uh, my path for environmental medicine and women's health, really being trained by our leaders in our profession, and Walter's no longer, with us, and I try really hard to kinda carry on his work.
So cool, so inspiring. It seems like you've had these guardian angels almost in during your path to guide you where you are, and for the benefit of so many patients, I'm sure. Which leads me to my next question. I'm not going to waste any time. I'd love to hear a patient case that comes to mind that really highlights the link between environmental toxins and all the health issues that we contend with, particularly in women's health, if you want to go that route.
Yeah, I think, well, actually want to start with a men's health case,
Sure.
because people don't quite realize that I actually see a lot of men in my practice, when you do environmental medicine. And then I can talk about some women's health cases. Because early on, I was maybe, just 4 or 5 years into practice. This gentleman, he was in his 50s, came to see me for tinnitus, ringing in the ear. And he worked in construction, and he was pretty convinced that it was due to being around loud machinery, working in construction. But I wasn't so convinced. I see hearing loss related to, concerts and loud machinery, but not always ringing in the ear, especially in that younger male population. And so I started just digging deeper and digging deeper and digging deeper, like we do as naturopathic physicians, and doing a little environmental intake at the same time I was doing a lifestyle and dietary intake. And it turned out he was eating tuna fish sandwiches every day at work.
Mm.
He thought he was being healthy, right? He said it had been like a recent change, and he was trying to eat less red meat. Even though he had no cholesterol issues, he wasn't overweight. He probably would have been fine on red meat. And I was like, ding, ding, ding. Tuna is one of the large fatty fish. It contains one of the forms of mercury called methylmercury. There's several forms of mercury. And the best way to test for methylmercury in fish is a blood test, not urine. And so I did a blood mercury test, and his levels were off the charts, even off the charts for the standard lab that I used, whose reference ranges are usually not tight enough, not low enough, compared to kind of some non conventional labs. And what the CDC really recommends. So his mercury, and when you do it in blood, it's methyl mercury. And obviously, I knew from my intake it was fish. It was elevated as I suspected. And so I put him on an 8-week treatment plan. And since metals were involved, he did need a pharmaceutical chelator along with some supplements. I have formulated some products for a company called Priority One. And then he did some sauna therapy and colonics. Um, and he came back. I always have people do the 8-week plan and then wait about 6 weeks to come back before we retest, because I don't want to retest too soon because the treatment could still have some circulating metals. And of course, I made him stop eating the tuna fish sandwich,
First step.
which I think was the hardest part of the plan for him. I do. I really think that was the hardest because it had just been his habit and it was easy.
Mhm.
And so his levels were back to zero, but the ringing in the ears was completely gone.
Mm.
So it was not due to the machinery, even though he was in construction. And the reason I wanted to talk about that case is for physicians who don't have environmental toxins in their forefront of their possible differentials of contributing to a symptom or contributing to a disease, they might have just said, oh, this is the machinery from
Mhm.
work, and never bothered to dig deeper. And so even if it looks like it's just maybe a blood pressure that's elevated
Mm.
or a ringing in the ears or a strange rash, and you would never even think about doing an intake for environmental exposures, please, everybody, do an intake and some simple testing for environmental exposures. So that was an obvious case. Do you want a women's health case now?
Sure, go for it.
Absolutely.
Okay. So, when I first started in practice, I started seeing patients who suffered from a now very common condition called endometriosis. And the condition, I mostly saw this in women in their late 30s, early 40s. This is when the lining of the uterus implants and grows kind of in the pelvic area. The tissue can even be, adhered to the fallopian tubes and affect fertility. It is one of the common causes of infertility. It can form a type of ovarian cyst called an endometrioma, which is more of a solid ovarian cyst. So it can implant on the ovary all the way up to the bowel, and cause cramping bowel movements, pain when the bladder's full, pain with intercourse. It can be really debilitating. It's not just menstrual cramps, although usually that's what drives patients in the door is they're having menstrual cramps. Um, so a few years into practice, it seemed like the age of patients with menstrual cramps and endometriosis was getting younger and younger and younger. I was starting to see high school girls
Mm,
uh, with suspected endometriosis, and then later confirmed with a um, you know procedure called laparoscopic procedure. And I was like, why? Why? I always joke either you can call me a 3-year-old when I'm looking for that root cause. Why? Or like an FBI investigator, right? I got to get to the bottom of it. And I really identified that, women especially are prone to the health effects of environmental toxicants, especially when they affect the hormonal system. And some of these chemicals are so common. They're in personal care products, not just food, air, and water, but they're in our cosmetics and lotions and shampoos and plastics. And, we're exposed to these chemicals. Um, so I started doing toxicant testing on these patients with endometriosis. Very few of them had elevated metals, but a lot of them had urine parabens elevated and phthalates. Urine's the best way to check for parabens and phthalates. Bisphenols, is another chemical that we see in personal care products. That one you want to check for in the blood. But and then pesticides and solvents, you test for either blood or urine, depending on like which pesticide you're looking for. But so I started taking these patients through this 8-week detoxification plan that I outlined in my book. I ended up just writing the book because I was giving so many handouts that it was almost, it's like I could actually, just condense the information and, throw the book in with the plan. And
right.
I published the results of this in one of my issues, one of the columns of the Townsend letter. I can't remember what year I published it. Where later, after the fact, I sent about 20 of the patients a survey who had all gone through the same protocol of detoxification, biotransformation, and cleansing. And the main outcome was a resolution of dysmenorrhea, their menstrual cramps. I did not use fertility as an outcome because fertility is so multifactorial that even, if you treat the endometriosis and free up the fallopian tube, they still might have fertility issues. So I used dysmenorrhea as the outcome. And we had great success in using detoxification, biotransformation, metabolism support with women with endometriosis.
Wow. That's pretty profound. And I found a staggering statistic. I'm curious of your thoughts on it, Dr. Marchese. And I actually believe probably the percentage is even higher, but it was from the United Nations Environment Program, and it reported that environmental risks and toxins are responsible for 20%, or excuse me, 26% of all global deaths. And that they said it was still on the rise. And of course, it includes factors like air pollution, unsafe water, exposure to hazardous substances. When you hear stats like that, what does that mean to you? And do you believe that that's even an accurate, depiction on that risk right now?
Yeah, I mean that percentage, I'm not sure where you said that number comes from, but when I look at global environmental health risks, I use the data from the World Health Organization. Um, and um, Worldwide environmental factors are contributing not just to deaths, but all cause mortality. So, increase in cardiovascular disease and pulmonary disease that may or may not lead to death. The biggest source of toxicant exposure when you're talking about global environmental health concerns is air pollution.
Mm.
Um, but air pollution travels. So you might be listening to this podcast and ignoring me right now because you think you live in a city with wonderful air quality, but pollutants travel. We know that, pesticides sprayed on the east coast of the United States, maybe due to wind travel, can end up on the West Coast or vice versa. You think about the recent, here we are in, 2023, the recent wildfires in Canada affecting air quality in the United States.
Mhm.
So, air pollutants travel. Some compounds in air pollutants, such as pesticides that have been banned in countries like the United States and the European Union countries due to their harmful health effects, may still be used in other countries. So even though we may have banned certain pesticides, for example, they might still come back due to air pollution and wind drift and air travel when they're sprayed in other, countries. So I think that the data, that the number you quoted, is probably underestimated. It's probably higher. Air pollution is probably the biggest. And then, of course, we have the health effects of climate change. That's the talk I gave this July at AANP. If you missed it, please go back and watch it. Also, it is the topic of the new book I'm working on, is climate medicine. Because I think the newer doctors graduating from school right now, they're going to have to understand how to treat the health effects of climate change. And one of that would be this air pollution situation and wildfires, for example.
Good point. Thank you.
Absolutely. It's unavoidable. I think some practitioners decided to do the environmental medicine route, but now we're coming up against it with every patient case, it seems.
Right.
So,
If you think about doctors in Florida, whether they're a naturopath, an MD, or a DO, they've probably never diagnosed malaria or seen a patient with malaria. Well, now mosquitoes are endemic in, for sure, I know it's Texas and Florida currently this summer, that are carrying malaria. So, things are shifting on what we're going to have to know how to recognize and treat.
Mm.
yeah, absolutely. Well, and so this is all very timely, and I'd love to dive into how you really address and assess. Really, how do you first assess these patient cases? And before we do that, I wanted to point out that I caught a Fox News segment wherein you go through a woman's home and you're pulling out all these toxic cleaning, personal care, food storage products. And I think all practitioners who are aware, we all wish we could do this, get into the patient's home, show them. There's nothing like really seeing it and experiencing that. Um, so, and I think we all wish we could do that. So, what specific testing methods, because we can't go into the home and actually show them, but how do you assess for toxic load? I know you mentioned some toxins are best tested using blood, some are best tested using urine. What's your favorite way to approach that? Is there a resource, because you're the expert, Dr. Marchese? So, in terms of which toxins are best tested in which specimens?
Yeah. Um, so one, for physicians, it's important that they think about doing toxicant testing on really almost every patient that walks in the door. And I know some doctors are like, no, I'm not going to do that. But um, the reason is because metals, solvents, parabens, phthalates, bisphenols, the perfluorinated compounds, right? Perfluorooctanoic acid, your PUFAs, which is in all of our food packaging now, um, is contributing to what your patient is suffering from. It might not be the root cause, but it's contributing. And this would be maybe you're the doctor who's specializing in integrative oncology, maybe partially, as the result of toxicant exposures. Or maybe you are the doctor who is only working on neurological conditions, or you only see pediatrics and they're sick all the time with ear infections, or they have autism or ADHD. There is so much data and research to show that chemicals in low doses from food, air, water, personal care products are contributing to these health conditions. So I encourage every doctor to pull out and dust off that environmental exposure intake history form, right?
Yeah.
Um, and start asking the questions. Are they exposed to lead from water or arsenic in their water? Are they eating too much fish high in mercury? What's the air quality like in their zip code, which could be, solvents? Are they living really close to a highway in an area of high traffic or the airport? Are they near farmland or orchards, or they bought that home on that beautiful golf course where there's pesticides being sprayed, right? Here in Phoenix, we have a lot of scorpion issues, and people are spraying harmful insecticides in and around their home, instead of using kind of natural, non toxic ways to eliminate the little critters that nobody likes to get stung by a scorpion. Trust me, they're painful.
Oh,
Um, and so it really starts with that exposure history. So then you know what you need to test for, because there's a lot of chemicals that you can test for, and there's a lot of different panels. There's different organochlorine pesticide panels, organophosphate pesticide panels, and the organophosphates are best tested in the urine. The organochlorines are best tested in the blood. There's different solvent panels. Whole blood is one of the best ways, but solvents are really hard to capture on testing because they have such a short half life that unless it's a very recent exposure within 2 to 3 days, or a high dose exposure, you might have to base pestic or solvent exposure on your history. But you need to know if there's metals present, because your treatment is completely different if metals are present. The gold standard per the CDC is lead should be tested for in the blood. You cannot use a urine lead level to tell a patient they have elevated lead and need treatment. It has to be blood. And then mercury has so many different forms of mercury that you're going to end up testing both blood and urine. I had already mentioned methyl mercury from fish best shows up in the blood. Inorganic mercury from like cosmetics and skin lightening creams is in the urine. From fluorescent light bulbs and dental work, amalgam fillings, the silver fillings, best in the urine. But I think one of the toxicants that people are forgetting that they can test for is the perfluorinated chemicals, right? The PUFAs. Consumer Reports this summer put out a big article looking at food packaging. And I'm not talking about like fast food, for people who are maybe thinking that they're not exposed because they only eat healthy. But yeah, I mean, obviously, fast food hamburgers and French fries, all that wrapping and cardboard, carton contains these chemicals. But they found them in, um, and I don't mean to pick on Whole Foods, but they were called out on in the article. So when you go through the hot bar and you have that little container you put your food in, that's coated with these chemicals. Or maybe Trader Joe's takeout food that then you heat up is coated with these chemicals. And during the pandemic, everybody stayed home and just ordered Uber Eats all day long, and all of that food was delivered in this packaging coated with these perfluorinated chemicals. And very few doctors are testing for those. And I think that because one of the health risks is cancer, and we are now starting to see colon cancer in people under the age of 50, that it's really important to start testing for these PUFAs, these perfluorinated chemicals. So, yeah, so there's lots of different tests, but it really begins with your exposure history.
Mhm.
right. Great reminder. That's where we need to start. Really have that pre-test probability, so we can refine our plan a little bit more. That's important. And what about testing for the impact of these toxins, Dr. Marchese? Of course, you have the clinical presentation. You mentioned endometriosis, maybe a symptom like tinnitus, PCOS, you talk about in some of your webinars, other very common women's health conditions. But on laboratory work, what are you looking for? Maybe stool testing or sex hormones, thyroid panel. What signs do you see?
So, one of the first tests that should be done is a complete blood count, because leukopenia could be caused by low dose toxicant exposure. The second test is a complete metabolic panel, because liver and kidney function needs to be optimal in order to go through chelation or a cleansing, detoxification program. And then, and this one might surprise people, the next one is a micronutrient panel. The reason is because all of these chemicals that I mentioned, pesticides, glyphosate is a big one. Metals, solvents, they can deplete our vitamins and minerals. And if you don't have adequate vitamin and minerals, now you don't have the proper cofactors for liver phase 1 and phase 2 biotransformation.
Mm.
So, I like to do a micronutrient test to see what is their calcium, manganese, selenium, magnesium, all your B vitamins, because they might be depleted from the toxicant. And then you need to have adequate levels before you do chelation or any type of cleansing detoxification. Because these chemicals also can disrupt hormones, I like to know whether it's a male or female patient, what is their current status of estrogen, testosterone, progesterone, DHEA, and cortisol. Because one, I want to know pre treatment levels and then repeat all of this testing afterwards to see what has normalized by simply removing the source of exposure and helping the body biotransform what they've already been exposed to. And then if things have not balanced out, now do I need to do hormone balancing and additional support?
Hmm.
Does that answer? So there is a lot of testing.
Absolutely.
But it makes sense. You have to peel back the onion to get to, of course,
Yeah.
the root of what's going on first, and see if they're even in a place to do the detox that's required. So I think
Yeah.
that's
And the other hormone that we should just pause and talk about is thyroid. When other doctors or even a medical student say, "Hey, Dr. Marchese, how do you treat thyroid disease, hypothyroidism?" I know that they're trying to ask me what pharmaceutical hormone I prescribe. And I say, well, I find the root cause of their thyroid disease.
Mm.
Do they have pesticide exposure? Do they have, lead and cadmium and mercury floating around affecting their thyroid, whether it's autoimmune thyroid disease or non-autoimmune thyroid disease? Are they nutrient and amino acid and iodine deficient, linked to toxicant exposure triggering their thyroid disease? So I still go back to the root cause. I mean, I have so many cases of thyroid disease being either improved or coming off medication after going through an environmental treatment protocol.
hmm.
Not enough providers are looking into that. I just want to throw that out there with the standard of care. And some of our listeners, they don't even, they're not familiar with conventional care because maybe they grew up in a home where they are only doing things holistically. But really, I mean, you get a TSH typically and it's Hashimoto's and that's it for the rest of your life. Then you're on thyroid replacement. So
For the rest of your life.
right. And so I just want to commend you and say that thinking about all those other contributing factors,
Mm.
just thinking about it and trying to get to that root cause and avoiding that standard of care, and really try to heal patients.
Mm.
That's huge. So thank you for that. I think it's really where naturopathic medicine shines.
Yeah.
I agree.
Well, we've definitely painted the picture, and as all functional medicine, holistic medicine is, it's so personalized to the individual and what they've gone through. But I'm curious, Dr. Marchese, if you could elaborate on some strategies or detox protocols that you've developed that have been just very advantageous to your patients, and also maybe give us, the everyday person, just some practical changes that we could do today to help minimize our risk.
Yeah, well, in my book, 8 Weeks to Women's Wellness, um, which men can read the book too, because it goes through 10 different women's health conditions. But thyroid men can have, osteoporosis men can have, but it goes through the links of these toxicants with 10 different conditions. But I include an 8-week kind of self-guided detoxification plan that people can take themselves through, starting with avoidance. The supplements that are in the book are now made by Priority One. When the book first came out, they were made by a different company. But, you know, I would say that what's really important for people to think about is initially avoidance strategies. So, what are the fish high and low in mercury? And are they eating fish too high in mercury? If so, stop, right? It's like, and start eating the tiny little fish like sardines, which, nobody seems to like
So
because they
true.
smell. I know. What kind of water source are they using?
Mhm.
You can test your home water with a company called watercheck.com and see, like here in Maricopa County where I live, we have high levels of arsenic in the water. Inorganic arsenic. Inorganic arsenic is in water, it's in rice, and it's in some poultry like chicken and turkey. So I probably just ruined Thanksgiving for everybody listening. But anyway, um, and so test your water, and use a reverse osmosis filter because reverse osmosis can remove arsenic and it can remove these perfluorinated chemicals that I mentioned, which are also in the drinking water. And then take a look in your kitchen. Start now after you get rid of the fish and clean up your water. Are you using a lot of plastic food storage containers? And can you switch those to glass? And yes, I know they have a plastic lid, but that's okay. The food is in the glass. And then go into your bathroom and look at your personal care products. Are you using products free of parabens, free of phthalates? Your cleaning products, are they free of solvents and fragrance? So there's a lot of things you can start to do without becoming paranoid about your environment, because that's not healthy and you can't completely avoid all chemicals.
Mhm.
You just do the best you can, right? And that's kind of where people really need to begin. The simplest thing you do is when you come home, take your shoes off. Don't walk around your house in the shoes that were just walking around on the street where animals might excrete themselves. And maybe you walked on grass that had pesticides,
Right.
or, you picked up chemicals on your shoes. Don't, take off your shoes when you come home. I know it sounds silly and simple, but it can be effective.
Mhm. Yeah. Yeah, thank you for stating the obvious. I think so many of us get so overwhelmed when we start to look at all these factors that contribute to toxins. And I love what you said. Just do the best you can. Start with where you're at, and those small steps really make a difference. So thank you. I know we're
Yeah.
getting close to wrapping up here. I'm dying to know, and I'm sure the listeners too. Are there any upcoming conferences or projects that you're excited about that you want our audience to know about?
Yeah, so my website is drmarchese.com. It's drmarchese.com. And I update where I'm speaking at conferences. Right now, I think I might be done for the year, but things come up. I've already done, two big conferences this year. And so I'm working on a new book, but that's just in the beginning phases. And, that's just kind of some of my projects right now. I'm adjunct faculty at Sonoran University. I teach gynecology and I teach environmental medicine, and focusing on making sure I'm kind of driving home all of these points to our soon to be graduates and future naturopathic physicians.
Well, we definitely appreciate you doing that. That's for sure.
We're so grateful. I had a course, thankfully, but I don't think that we focus on it enough in clinical practice when we got into the clinic, and you learn so much when you get out. So really prepping these soon to be providers and naturopaths in particular is very commendable and timely. So with that, Dr. Marchese, we're going to wrap it up. And thank you so much for being here. You've shared clinical pearls, practical wisdom, and we'd love to learn a little bit more about you on a personal level. If you would so be inclined to answer 3 rapid fire questions before we let you go. Are you game?
Okay, sure.
Okay.
Fantastic.
Uh, Jen, you have the first one.
Okay, Dr. Marchese, if you could have dinner with any historical figure, who would it be and why?
They're supposed to be rapid fire, but I can't think
That's
that
okay.
fast.
I like your thoughtfulness. Take your time.
Is this alive or
No, no, no. It's not live. We can edit
no?
out.
Alive?
Oh,
Are the
alive.
people
Oh, I'm sorry.
alive?
Yeah, it could be alive or deceased.
I would want to have dinner with Warren Buffett.
Oh, I love it.
We're both from Omaha. We both like steak. And I admire his simplicity of life.
Mm,
He's lived in the same house in Omaha for like 50 years, and has kept his company really small and has given away most of his wealth. I admire that.
Yeah,
that's awesome.
inspiring.
Yes.
Okay. How do you like to spend your alone time, Dr. Marchese?
Reading. I read books, not on a Kindle. I like paperback books or hardback books. A big fan of my public library. I think everybody should have a library card. I read books.
Are you reading nonfiction science books or are you reading fiction for pleasure?
I'm reading fiction for pleasure.
Okay.
Yeah, I
Fantastic.
just finished a book called 7 Letters about Ireland. Yeah,
Oh, okay. I would love to see Ireland one day. Have you been to Ireland?
I have.
Okay. And that's perfect segue for my next question. What vacation spot would you like to revisit?
Revisit. Probably back to Ireland because I was there in 1989. And Game of Thrones has been filmed in some areas of Northern Ireland, and I would love to do the Game of Thrones tour.
Me too.
That's cool.
Sounds great.
All right. Well, that was fun. Thank you so much again, Dr. Marchese. We hope to have you back sometime soon. And for our listeners, thanks for tuning in. And until next time, stay vibrant. Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness Podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guests and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.